NSFW, morgue workers, pathologists, medical examiners, etc. What is the weirdest cause of death you have been able to diagnose? How did you diagnose it? I'm not a medical professional or a mortician, but I think this story is relevant to the question, so I'll share it anyway. A few weeks ago I was driving a guy to a hospital 3 hours away. He was a truly amazing man and regaled me with a myriad of fascinating tales of his youth and previous jobs. He got on to explaining his family and how he had 2 nephews but now only had 1. I asked him what happened. Apparently his eldest nephew, around 28, was riding his motorbike on a weekend out in the countryside here in the UK. They found him later that day, dead, on the side of the road, on a corner, motorbike next to him, with no obvious signs of impact or anything that could possibly have led to his death. It took a long time for them to work out what had happened. Eventually they found a small bruise about ½ an inch in width on his temple. After some investigation they discovered that the corner of road had just been resurfaced and had some loose stones on top. They concluded that as he rounded the corner at about 30 miles per hour, the bike had slid from underneath him. As he rolled to the side of the road, the footrest of the bike had entered the corner of the helmet through the hole where the visor was open and hit him in the temple, killing him instantly. Nothing reckless, no one else involved, just bad luck. Sometimes that's all you need. And this is one of the reasons why surface dressing is a terrible method of resurfacing roads. A cheap fix that will need to be resurfaced again the following spring when it is full of holes again. The technician here. Where I worked we got a lot of bad cases because we worked with the sheriffs and county, so we got all hoarders, neglect, etc. We had a chicken with maggots crawling all over its back and literally it was just constant movement, to be euthanized. While someone was holding her on the treatment table waiting for a doctor to become available for euthanasia, her entire back end exploded. Clear fluid and maggots about 8 feet sprayed out. Her bladder and a giant cyst sac fell out of her and she passed. I never thought I would see the day where I was able to say I had a chicken explode on me today at work. My father was a field agent for a medical examiner's office in Texas for about 25 years and on rare occasion recounted some of the experiences from the job to me. Most cases in the county for which he worked were natural deaths, suicides, or traffic accidents. His first case, however, was a very unusual homicide. The victim was a postal worker who had been struck with an axe by a teenage boy. It turned out that the boy had been lured into the postman's home and was being sexually assaulted when a struggle ensued. The boy grabbed an axe in the home and swung at the postman, killing him. Freaked out, the boy called 911, reported the body, and my dad showed up. There are other tales from the ME's office my dad shared with me, but they are either not interesting for their means causes of death, were used as cautionary tales against me being an idiot teenager. Don't buy a motorcycle, wear a seatbelt, etc. Or don't have to do with somebody in particular dying. For example, some serious examples of gallows humor. TLDR. My dad worked in the medical examiner's office in TX and his first case was an axe murder. X-ray tech here. Heard from a fellow employee. X-ray tech did a chest X-ray on a male in the ICU with severe pneumonia. He was barely able to get a breath. On an X-ray his lungs were completely white. White means dense, hard material, like bone or metal. Lungs are a mixture of black, air, and grey, tissue mucus. The X-ray tech is puzzled by the complete whiteness, wondering what kind of material it is or what happened to his lungs, so he called the doc for a medical history. The doc replied thusly, "Patient was on a bender, looking for drugs. He broke into his neighbor's garage and found a batch of powder in his neighbor's fishing tackle box and snorted the whole thing. A few days later he developed pneumonia. It turns out that the fisherman neighbor's sister had died years ago and the fisherman kept her ashes in his tackle box, so she went with him whenever he went fishing, just like when she was alive. The patient had snorted the leftover metallic ash off his neighbor's dead sister. He died a week later." Nurse here. Had a patient who had not had a bowel movement for 14 days. Tried enemas, Miralax, digital disinfection, etc. Patient started having extreme anxiety and shortness of breath. Doctors were aware. Hours later she ending up vomiting her own stool and choked to death on it. She was so full of poop it had nowhere to go but out her mouth. TLDR. Patient died from vomiting and choking to death on her own crap. I threw up poop while I was in the hospital. It was weird. Just to be clear, I didn't die. I guess I'm late to the party, but here is a second-hand experience of something my brother cousin went through a few years ago. It's the freaking weirdest thing I've ever heard and it's worth a read. I need to share this with more people. Damn it. So my cousin and his best bud from med school wound up at the same hospital. His friend became a mortician and my cousin is a proctologist. One morning my cousin gets a call from a patient he had an appointment with later that day. The patient asks secretary if he could come in early. His issue was getting far worse. When asked what was wrong, he refused to explain and demanded to speak with my cousin. Now, my cousin has terrific bedside manners, the best I have ever seen. He makes it a point to speak with his patients whenever they need to. So he gets on the phone with this guy and the guy starts pleading with him. So my cousin had an opening and told patients to come in during that time. So patient comes in and is sitting in the exam room. My cousin walks into the room and asks him what's wrong. Patient proceeds to strip fully nude, get on all fours and stick his butt out at my cousin. While on top of the exam table, the guy began to explain how his butthole keeps leaking crap and it hurts really bad. Except my cousin apparently immediately saw that it wasn't leaking crap at all. The guy was leaking half of his goddamn intestines. Like, half a foot of intestine was just protruding from this guy's anus, and would throb and pulsate with every breath that patient took. At this point I wish I could say my cousin got the guy the help he needed. But before my cousin could do anything, the guy just screamed, "Just yank this goddamn crap out of me, man." Get IT out as he reached behind himself and yanked his goddamn intestines so hard that his butthole erupted with a fountain of blood, coating the nurse and my cousin. That was apparently the most inhuman scream that Steven, my cousin, had ever heard that day. The guy was in so much pain after yanking his intestines out that he passed out and fell off of the exam table, smashed his head on the corner of a chair, and died instantly. So cue Steven's best friend, the mortician, does an autopsy. Cause of death was pretty straightforward all things considered. But apparently his friend found an unraveled slinky string throughout patient's digestive tract. Like, the guy took a slinky and ate it while straightening the metal out. All in all, makes me shake in anxiety just thinking about the whole thing. I just physically recoiled. Work as a medical assistant in a hospital. Had a guy come into the ER with maggots eating his legs. He then ate the maggots, mentally unstable, and died later that night. Not sure what the cause was, but I think it was probably the maggots eating his freaking legs. Likely undiagnosed and treated diabetes mellitus caused the necrotic legs and maggots, and probably sepsis or septic shock killed him ultimately. I worked in a clinical research that needed to have adjudicated causes of death. For example, a nurse who reviews medical records and provides an external, professional opinion about how a death plausibly happened, so that we could determine if it was related to the randomized drug they received or not. One medical record read, "Cause of death, found dead upon arrival, showing signs of death." Well, that sounds like an easy job. Where do I sign up? My time to shine. I'm a former paramedic and currently work as a therapist in an inpatient nursing home. They are known as community living centers, but I digress. I had a hypersexual client who would masturbate with a urinary catheter in place. Ended up getting a UT and died due to complications associated with it. We would joke that he died doing what he loved. The place is ashore of a lot quieter without him. He was a lot of fun to work with. Cop here. We attend deaths at home. A guy had died of an overdose, and with it being the middle of winter, he had the heating on. He collapsed in front of his gas heater with his Jack Russell dog in the flat. The heater essentially cooked the guy and the dog ate his face below the nose completely off, except the jawbone, and down to his left arm. He'd been there about 3 months. Animals are loyal until it comes to their own survival, much like humans. The dog probably realized the man was dead. I wouldn't call that disloyalty. If I died on a deserted island, I would rather have my friends cook and eat me than have them starve to death because I died off a stubbed toe and was the only one who could hunt. This is a story that was told to me by my college professor, and then, strangely, verified by my father. Back when my professor was a med student, he used to go watch autopsies, as a med student generally does. One day, he walks in on a fat, bearded man from Connecticut of an approximate age of about 70. He was also very much dead. The cause of death was technically an implication of the heart, but when they started to explore his feet, which were covered in large welts, they found massive deposits of calcium crystals which had begun to form in the legs and feet of the man. Initially, they thought it was a very strange case of the very mundane condition calcium pyrophosphate deposition, until they found a massive collection of calcium crystals, and my professor swears they were crystals in the foot of the man. Now, this would take a lot of calcium. According to my professor, about the equivalent of eating a small pack of Tums a day, or whatever those antacids are called. That Christmas I was home telling my family about this strange story, when my father, who was a young engineer in Connecticut at about the time this story would have taken place, and he used to work with a bearded, 70-year-old man, who ate a jar of Tums every day until he died. There is slightly more to this story, as I pretty much did verify the men both my dad and professor knew were one and the same, but I am eating pizza and I have work in less than an hour and I need to make this quick. I run a forensic science summer program for high school students and we take them on field trips, one of them being a forensic medical center. The ME there said that he once had a body come in without a head. The man apparently was decapitated, and his body was then dumped in the river. The kicker is, though, that the killer was the boyfriend of the victim. His boyfriend was found to be in possession of his dead boyfriend's head. The head had traces of semen in it. The stomach contents did not. Decapitated stripper. I interned at a law firm. We had a client that went to a strip club. After a few drinks he decided to take a stripper out for a ride on his motorcycle to impress her. He hit some sand and fell off, but she flew off, hit a stop sign with her neck and cleanly decapitated her. It was messed up. My father has been a forensic pathologist, meaning his specialty is disease, but is also very well versed in all manner of deaths and trauma, especially bullet wounds and knife wounds, for many years. Unfortunately I am unable to get in contact with him at the moment, otherwise I'm sure he would have a field day on this thread. Being the kid of a ME is weird. When my dad would pick me up from school, it would not be uncommon for him to be on the phone with an official saying something along the lines of, "Oh yeah, he shot her in the back with a 12 gauge. Yes, the kids too," into the phone. Or when I asked him how his day was, he would say things like, "Well, I had another obese dude today, so I'm really tired." I also remember finding a picture of a dead baby when I was setting the table for dinner. If I can get in contact with him before this is over, I'll add some of his stories to this comment. He's a super good storyteller and a competent writer, unlike myself. Update: I got in contact with my dad. He is a little cautious and a Luddite at heart, so he wants to dictate his stories to me and then review them before I post them. I'll be seeing him on Monday if all goes as planned. Hopefully I'll have some interesting causes of death to share by Monday evening. Update 2. Due to issues of privacy, my father has refused to contribute. He did so at the last minute, saying that he didn't feel comfortable. I would like to apologize to all the people who were following for a story. I would like you all to know that because of this comment I was able to have a wonderful conversation with my father that, although fruitless in Reddit story cred, really invited my father to open up to me about some of the more intricate difficulties that come with the job of autopsy. Not a medical professional but was working as a security guard at a major hospital, I saw several disturbing things come into the air. I got a few stories. I'll share one of the weirder, more interesting. Ambulance rolls in hot. I'm on the dock and open the back door to find big Olay biker looking dude strapped to the gurney trying hard to come off of it, struggling with the paramedics and hollering, "Let me die. I want to die. Help." The paramedics get him back into the air and begin to hear the story. Biker dude has attempted suicide with a pen. He stabbed himself in the chest with a pen, pulled out the pen and repeated the process over a dozen times. Now I'm thinking I'd really have to want to die to stab myself in the chest, but I'd really have to want to die to pull it out and repeat. Biker dude really wants to die. He doesn't care how many paramedics, nurses, orderlies and security guards he has to fight. There were 14 of us who held him down for the docs to work on him. He was restrained, but he was a big old biker and would have come out of the restraints without us holding him down. Turns out biker dude has pierced his heart and blood is pumping into and filling his chest. We have a young resident who is in the phase of training where he is to make the decisions while the experienced doc looks on. Resident is in a panic and asking the older doc what to do. Older doctor answers all his questions with "You're the doctor. Is that your decision?" The decision is that the blood must be drained from his chest before it stops his lungs from functioning. So the doc takes, I crap you not, a cordless drill and chucks a hole saw about the diameter of a quarter and drills a hole through biker dude's ribcage. He then inserts a plastic tube and drains the blood into a 5-gallon bucket sitting on the floor. All 14 of us hold biker dude down while this is going on. As you probably imagine, bike dude got his wish. He did not live much longer than it took to drill his chest. I coordinate anatomical donation and read the death discharge summary charts for over 20 people a day, and the weirdest ones I can think of are the deaths of totally healthy people doing totally normal things in life who just freaking die, undetected heart defects, massive hemorrhages, aneurysms, etc. Weird, scary crap. An aneurysm can happen anywhere at any time. That's what makes it so terrifying. I'm an RN in the aged care field. We had a resident who was at the end of her life with ovarian cancer. She had ascites, buildup of fluid in the peritoneal cavity causing the abdomen to swell. She died when somehow her peritoneal cavity and then her stomach or something else ruptured, causing all of the light brown colored, odorless fluid to gush out of her mouth and nose, and there was a lot of it. She had been lying there talking and then said she felt off, and not long afterwards it happened. I like to think that she wasn't conscious when it happened because her face was very blank and her eyes vague throughout the process, but man, that wouldn't be a nice way to go. My grandfather did some work as a doctor in Indonesia. He told us stories of people who'd had pathogens living in them and eating them from the inside out, some in really grotesque ways. Some people had fungus on them that basically sucked their lives away, so not a coroner, but still kinda interesting and gross. One time we found a man who had DIY nailed a rusty nail into the middle of his tibia, not surgical repair, and in fact sticking out of the skin. The tissue around it had healed, so it had clearly been there for a while. It was not his cause of death. 3 bottles of wine a day was. On a related note, I am always astonished at the sheer amount of veto people are able to put through their systems over a sustained amount of time before it finally kills them. Then there was the homicide case where it turned out there was a tiny, first trimester fetus in her uterus. It was not reported in her chart that she was pregnant, so she may not have realized it yet. Regardless, in my state this becomes a double homicide. Then there was the poor woman who choked on a chicken nugget and died. What's the worst way to die is the next most asked question, to which Melanek usually replies, you don't want to know. When people insist, however, she tells them about Sean Doyle, around Christmas 2002. Bartender Doyle went out drinking with pal Michael Wright and Wright's girlfriend. As they all walked home, Wright thought Doyle was hitting on his girlfriend, and witnesses later told cops they saw a man getting the ST beat out of him. He was heard screaming, "No, don't break my legs," and another witness said he saw someone throw Doyle down an open manhole. The drop was 18 feet. At the bottom was a pool of boiling water from a broken main. Doyle didn't die instantly. In fact, as first responders arrived, he was standing below, reaching up and screaming for help. No paramedic or firefighter could climb down to help. It was, a Con Ed supervisor said, 300 degrees in the steam tunnel. 4 hours later, Sean Doyle's body was finally recovered. Its temperature was 125 degrees. The medical examiners thought it was likely way higher, but thermometers don't read any higher than that. When Melanek saw the body on her autopsy table, she writes, she thought he'd been steamed like a lobster. His entire outer layer of skin had peeled off, and his internal organs were literally cooked. He otherwise had no broken bones and no head trauma, which meant he was fully conscious as he boiled to death. The worst nightmares I ever had in my 2 years at OCME, Melanek writes, came after I performed the post-mortem examination of Sean Doyle. Weirdest case was a guy who committed suicide. Wasn't hard to figure out, but the weird part was that he and his friends were having some sort of suicide race, like, who could kill themselves first. We realized this kid, 21 I believe, had OD'd on a mix of alcohol and some other stuff. That was his 3rd attempt that week. We saw that our pedestrian versus train from a week before was one of the friends in this pact. Don't commit suicide by train. It's really messy and we gave to walk like a half mile of tracks to make sure we found all of you. Plus you're forcing the conductor to kill you. But the thing that made me mad was that this guy knew he was trying to commit suicide, yet he wore 3 damned pair of pants. And I was in charge of undressing the body. We couldn't cut the clothes off in case the family wanted them or something. Undressing a body that's already in rigor is hard. He had a pair of jeans, then a pair of Superman pajama pants. Underneath those, a pair of Charlie Brown Christmas boxers. In February, I swear he did it just to pee off a morgue worker. That happened to be me. Another weird one was the guy who committed vehicular suicide by slamming into the Jersey wall on the highway. Car stopped. His body stopped. His heart kept going. Completely transected and fell into his thoracic cavity. Then the car burst into flames. So we had a super crispy critter that came in. He was in burn position and completely blackened to a charcoal-like state. His brain looked like a hard-boiled egg and his blood coagulated into blood jello. That was a mess. All because his GF dumped him. The 29th of June 2007. I am driving home from a birthday party for my sister up I-45 through Houston. It's dark and 230 am and there is a body laying horizontally in the right lane of the highway. I pull over to pull this guy off the road to see if he's okay. But as I get out of my car, this guy on a motorcycle, not wearing a helmet, T-bones the guy in the ribs and does an endo head first into the concrete. Somehow he is freaking Spider-Man and jumps up with just some crazy road rash and broken ribs. We pull his bike off the road and try to get to the guy laying in the road. But too many cars are coming 70 miles per hour down the highway and we can't. I'm standing 10 feet away from this guy as he gets pummeled by one car after another. By the time we get the cars on the highway to stop the guy, and the road's head and brains are gone and splattered down the road. When the cops get there, I'm standing there with his blood on my jeans and most like his cell phone in his hands that I found on the road. Evidently, he was crouched in the road when a semi/18-wheeler, whatever they call it where you're from, came up on him. The trucker didn't see him until it was too late and the guy stood up and then was smashed. The guy had just got done drinking at a bar and ran out of gas. Decided to walk to the nearest gas station when he dropped his phone or something else onto the road. Bent over to pick it up in a drunken stupor and never saw the truck coming. Pre-med student here studying forensic science. I had a case study my first year about a man trying to illegally immigrate through a freight of bananas. He was found in the middle of a bunch of boxes of bananas, hitting butyric fermentation. His right leg was more swollen than anywhere else. This poor guy got bit by a spider in one of the banana boxes and was unable to get out to seek help. That's just unfortunate. Technically he still made it to America. I had the pleasure of being a contracted developer to help implement a case management system for a state medical examiner. CODs are an awful thing to read. There are so many ways to become no more. One that still sticks in my mind is the roofer who was breathing fumes from an industrial-sized bucket of glue. He passed out and his face dropped into the glue. He asphyxiated and was brought to the morgue still holding the bucket. There was a case study of a man that had a bowel blockage so couldn't poo. He ended up throwing up the poo and accidentally inhaling some. The poo filled up his lungs and he died of pneumonia. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.